Hi all, welcome to this week's Q&A. I'm Zsuzsa Kecskés, the Acting Director of the ANU Medical School. Thank you for sending in all your questions. I hope you've had a somewhat restful weekend and managed to recharge your batteries, keeping your social distancing. Remember, this is a marathon, not a sprint, so it's important that we maintain our strength through those things that we'd like to be doing when we're at home. The questions that were sent in this week, starting off with the question from a student about not having completed their TB screening and what to do. The Department of Respiratory Medicine at Canberra Health Services is reducing all their non-essential, non-urgent activity. This is to relieve the pressure on the health system and to reduce the spread of COVID. So for those of you who have not done their TB screening yet, please hold off. Do not go to Canberra Hospital and you will have to do your TB screening at a later point. Can I please also remind you that the access for students to any of the hospitals, Calvary, the rural nodes and the Canberra Hospital has been stopped until further notice. I'm thinking of taking program leave. What is the process? You know that the ANU census date has been moved further far to the 8th of May. If you're thinking of taking program leave, please follow the usual process, contact your year coordinator, and then send me an email and we can discuss the reasons for your program leave and we can take it from there. For those of you who are still considering or who are staying, that is of course okay. You've got until the 8th of May to make a decision. Is there any potential for the medical school to be reopened before the 27th of June? Unfortunately, the campus is closed. The campus is closed for students and for staff, so there's no opportunity for us to open the PBL rooms. Please note that also the Building 4 on Canberra Hospital campus is closed for all students and is only accessible by swipe card for essential staff. I live on ANU campus and I'm confused. Shall I move out? Can I get back? The information on the residences is on the ANU website and I understand you've been sent an email. There are students who are away from their residences at the moment and who are asking whether it is okay for them to come back, particularly the Phase 2 students. I am meeting with the Director of Residential Experiences tomorrow and we will clarify what the process is. Please be patient until then. I will give you the information this week. Dr. Messerly has sent updates on what our exams will look like this year. But how does the medical school plan to make special considerations for those heavily affected by this situation? There is no simple answer to this question. Every student's special considerations will be assessed on their own and on an individual basis. We will handle them case by case. Those of you who think that you will be severely impacted may need to think about whether you need to take program leave and come back next year and do the year again next year. Will there be some kind of intensive face-to-face teaching period for clinical skills and once the school is reopened? Yes, we are planning for intense teaching once the campus opens again. This will be not just for clinical skills, but for other disciplines and between the phases as well. We do not have any information, we do not have any details, we do not have any dates for that at the moment. Please be patient, we will inform you when we get there. Is it possible to extend the opening of the online Cura Clouds from Thursday and Friday to Thursday through to Sunday? I am not sure why that is not possible. All the Cura Cloud sessions should be open for the whole fortnight. It may be that the Odd Academic will close a session to amend it, but they should all be open for you for the 2 weeks. Is there any potential of reducing or condensing the Cura Cloud material into what's most important or splitting it into basic and advanced concepts? Well, we can try to do that, but as you can imagine, that is a heavy workload. It would be better if the students actually helped each other, provide study hints, not just for yourselves and for the other students, but also to the lecturers, noting that the lecturer may not be available straight away to answer your email, but that way you can actually determine what you think is essential and what is basic. Remember, we will examine you on the learning outcomes and we will Pulse QR Clouds and the lectures is a teaching aid to achieve those learning outcomes. How you achieve them in the end is yours. You do not need to watch everything, but please consider that a lot of information is on these QR Cloud sessions, and that is there to help you learn and for you to achieve your learning outcomes. I also received some questions about the use of Zoom, especially if you do not have a university number. So those of you who have a U number, you can make use of the university's corporate license for Zoom. Just download Zoom on your Mac or on your Windows computer, log in with your U number and your password, and then you can use Zoom. If you do not have a U number, you can still download the free basic license for Zoom on your device, but please note that there's some limitations in the duration of the meetings that you can hold and the participant numbers. Whom can I contact for support if I'm struggling? A lot of information is on the ANU website, and I'd like to refer you to that. If you're worried, if you're anxious, or you need some support, please also make use of the counselling services that are available to the ANU community. And staff and family can access free support and counselling through the Employee Assistance Program. Details are on the ANU website. For the students, I'd like to say, please make use of your peer support program that the MedSoc has set up. Your peers are your best friends at the moment. Please also feel free to contact the year coordinators, the phase associate deans, the deputy, or me directly through our email. We're always there to help you and to answer all your questions. Well, this is it from me for all your questions. Please keep them coming, and I will do another session like this next week and answer the questions, hopefully in a timely fashion, if you do not have time to read the emails that we're sending out to staff and students during the week. Thank you, have a good week. Please stay safe, keep your social distancing, and keep your chin up. Thank you.